Hey everyone, welcome back to all my listeners. This is episode 12 in season 14. Today is Wednesday, March 19th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, so let's just get into today's episode. Now, my Newsworthy is going to be featuring my spotlight on the month of March's Awareness Month, and I wanted to talk about multiple sclerosis, or MS awareness. And in my Trusty tip, I wanted to highlight something I've been seeing, this code for tobacco cessation for, a little over 7 years now. It's just been misused. It's hardly paid. Again, it's because of documentation. Now, NGS has a great article that they just issued, and I wanted to dive into that and hopefully give my audience some tips and tricks on how to get reimbursement for tobacco cessation when it's used in CBT or cognitive behavioral therapy services. And of course, I'm going to go ahead and close out and round out today's episode with a remarkable quote on change by Paulo Coelho. Today's episode is sponsored by HCPro. HCPro is a leader in healthcare compliance and mid-revenue cycle training. They offer solutions that enhance organizational performance through education, credentialing, and professional development. With over 30 years of experience, HCPro is the trusted education partner of the nation's leading health systems, top post-acute care facilities, critical access hospitals, regional health clinics, revenue cycle management, and healthcare BPO organizations. HCPro understands mid-revenue cycle training challenges and is committed to helping healthcare organizations fortify their teams to drive alignment, efficiency, compliance, and stronger reimbursements. Go ahead and contact HCPro to learn more about their enterprise solutions at 1-800-650-6787 or visit them on the World Wide Web at www.hcpro.com. Let's dive into Newsworthy. So the month of March is dedicated to MS awareness. Now, MS is multiple sclerosis, and there is a wonderful organization here in America that is called Multiple Sclerosis Association of America, or MSAA. And they've devoted the entire month of March on a campaign that they have titled, quote, Empowered from the Start with MSAA. Now, I love the webpage and all of the content that they have developed for this entire month, and I wanted to go over it with my audience. I think it's absolutely remarkable, especially for those people in the country that have been newly diagnosed with this condition. Now, Empowered from the Start with MSAA focuses on education, empowerment, and support for individuals who are newly diagnosed with multiple sclerosis. This initiative provides essential information on MS, guidance to navigate treatment options, emotional support, resources, and inspiration to help individuals achieve well-being while fostering a strong sense of community for them and their care partners. Now, MSAA goes on, and they talk about what does newly diagnosed with multiple sclerosis mean. Now, for many, being newly diagnosed finally gives a name to having some unexplained symptoms. Often before a diagnosis of multiple sclerosis, again, that's MS, a person might experience various symptoms, such as visual problems, numbness, or weakness, for example. Not knowing what's wrong and what might happen next can be both worrisome and frightening. When individuals are newly diagnosed with MS, they may actually feel a sense of relief in knowing the reason behind the many different symptoms. But coupled with this relief, many may also feel fear and anxiety over this new diagnosis and what the future may bring. From here, learning more about the disorder and its treatments will be of great help toward developing a positive plan for moving forward. If you are newly diagnosed, you may have never heard of the term MS before, and some people even confuse the name with other disorders. You may feel very alone, but you are not. It is estimated that nearly 1 million people in the United States have MS, as well as nearly 3 million people in the world. Many individuals with MS continue to work and are active in their communities. Some who you might even know, but may be unaware of their diagnosis. While finally getting a name for your symptoms may give you a sense of relief, you may also still feel frightened and confused. After all, MS can be quite unpredictable with its hallmark flare-ups and remissions. You may feel you have lost your compass, your perspective, and everything experienced now is under this new label of an MS patient. Now let's go over some MS symptoms that are pretty common. Now, individuals with multiple sclerosis may experience one or more of a variety of symptoms, possibly affecting individuals physically, emotionally, mentally, psychologically, and in ways that others can't see. Those are the invisible symptoms of MS. Now, the types and severity of symptoms differ greatly between people with multiple sclerosis. So one person's experience with this disorder may be very different from another's. Now, some of those common physical symptoms of MS include balance problems, bladder dysfunction, bowel problems, mobility and walking issues, sexual dysfunction, spasticity or stiffness, speech difficulties, swallowing disorders, and tremor. Now, some of the common emotional, mental, and psychological symptoms of MS can include anxiety, cognitive changes, depression, pseudobulbar effect or PBA. And of course, some of those common invisible symptoms of MS include dizziness and vertigo, fatigue, what's known as the MS hug, numbness, pain, sleep issues, Uthoff's syndrome, visual disorders, and weakness. Now, of course, MSAA goes on in their webpage to talk about symptom management of MS. Now, while multiple sclerosis has the potential to cause several different symptoms that I just went over, the specific symptoms each person experiences vary greatly. Now, when experiencing one or more of these symptoms, an individual should consult his or her physician. Medications are available to treat many multiple sclerosis symptoms. These may include over-the-counter drugs as well as prescribed medications. Diet and exercise may also be helpful with managing certain symptoms. All treatments or changes in diet or exercise should only be done under the guidance of a qualified physician. Multiple sclerosis symptoms are often compounded by extreme fatigue, which may be worse in the afternoon, sometimes relating to a rise in body temperature. Some symptoms may be temporarily increased by heat intolerance, a classic MS tendency, where a rise in temperature internally or externally causes a person to feel much worse. Keeping cool through air conditioning or various cooling devices may be helpful for people with heat-sensitive multiple sclerosis. When recovering from a symptom flare-up or learning to cope with a change in mobility, rehabilitation through physical therapy and occupational therapy can be of great value. Speech therapy, therapeutic exercise, and certain medical devices may also be useful in dealing with the symptoms of multiple sclerosis. Some of those who have a physically demanding or highly stressful job may choose to make a career change, in which case vocational training is helpful. When a family member is diagnosed with MS, participating in some type of counseling program is often of benefit to everyone involved. Individuals may be affected in different ways, both physically and emotionally. Seeking professional assistance helps to ensure that MS does not disrupt one's family and happiness. Now, finally, let's go over some of the multiple sclerosis symptom medications. Now, there have been a number of effective treatments that are made available in recent years to reduce the effects of most MS symptoms. Several medications mentioned throughout this webpage, which I have not gone over, but there are plenty of oral medications as well as injectables that people take and are highly effective. Now, several medications are not specifically approved for multiple sclerosis by the United States Food and Drug Administration, the FDA. However, doctors may prescribe these medications off-label for some of their patients if appropriate. Now, while this list, again, on the MSAA webpage, While this list may include many of the medications commonly prescribed for the symptoms that I listed, other medications not appearing may also be prescribed by a physician depending on the specific circumstances and the doctor's preferences. Additionally, medical marijuana or cannabis has been used in treating certain MS symptoms such as pain, spasticity, and sleep issues. Studies with cannabis for symptom relief in MS are limited, and the results have been mixed. Your healthcare professional can help you to better understand the risks versus the benefits of cannabis in treating certain MS symptoms. Now, I will be sure to put a link to the MSAA webpage in my show notes. So be sure and dig deep and research and raise awareness this month for MS awareness. And now it's time for my best practice tips in Trusty Tip. Now, NGS, National Government Services, has a brand new informative article that they've released on tobacco cessation and cognitive behavioral therapy. Now, as I hinted at the beginning of the introduction to this podcast, I have seen the tobacco cessation CPT code as well as documentation over the years just be very deficient, if not overreaching. Documentation really needs to support the fact that providers are carving out time in their session to talk to their patients about tobacco cessation. Now, NGS has this new article specifically on how to combine tobacco cessation into cognitive behavioral therapy sessions, or CBT sessions. Now, CBT is a type of psychotherapy that's problem-oriented. It may help your patients learn how to change unhelpful or unhealthy ways of thinking, feeling, and behaving, especially when related to tobacco cessation. CBT can be useful in helping individuals to learn cognitive coping skills required to manage negative moods or urges to quit tobacco use. Now, key CBT skills for tobacco cessation include problem solving, changing thought patterns, understanding the quitting process, identifying triggers and motivational cues, aversion therapy, and social support. Now, these skills empower users to exercise self-control, restructure their thinking, establish goals, like setting a quit date, self-monitor habits, and receive rewards and skill training to resist tobacco urges. Now, CBT is often used alongside other treatments to support patients facing depression, anxiety, or other mental health challenges during tobacco cessation. It offers valuable resources for addressing both underlying and acute symptoms that may arise during withdrawal and treatment. Now, CBT can also be provided via telehealth. Generally, any provider who is eligible to bill Medicare for their professional services is eligible to bill for telehealth during this period. Now, federally qualified health centers and rural health clinics can provide telehealth services to patients wherever they are located, including in their homes. This includes coverage for certain audio-only telephone evaluation and management services. And of course, the United States Congress just passed through the House the fact that our telehealth services will be extended past March 31st, again, just in a week or two. They've extended it now for another 6 months through the end of September 2025. So that's some good news as well that I wanted to throw in and mention right now as I'm talking about CBT and telehealth. Now, providers must ensure that all performed services are claimed and supported by complete documentation. Again, something my audience has heard me talk about for years. So just because there's a code for something, right, doesn't mean it's going to be reimbursable. We have to make sure that that documentation is supporting it, because there are often times when these codes can just get paid by the payer, in this case by CMS, but they may want to do a post-payment review, right? A post-payment audit. And that's when they're going to request for that documentation. So when they take a peek, that documentation has to support this type of CBT therapy, this type of tobacco cessation. So now, this documentation for smoking cessation documentation, according to NGS services here, according to this MAC, It should reflect the type or method of tobacco use. For example, is the patient a smoker via cigarette or a vaping device or a chewing tobacco, etc.? The documentation should also reflect the amount of use, right? Are they a 1 pack a day all year round smoker? Give the quantity, the amount of use. Assess if the use qualifies as dependence, right? So you can make sure that ICD-10 diagnosis code is supported there as well. Also, your documentation should be reflecting the impact on those around you and things around you. So the impact personally, if it impacts your family, your friends, your health, your social situations, your finances, etc. That should be documented. Also, the methods and skills for cessation. So what are you doing to stop? Are you using a patch? Are you chewing the nicotine gum? What are you doing, right? Talk about that in documentation. Also document the resources that are available, what you've helped your patient use as a resource. Also the willingness to attempt to quit. Document that. If the patient is willing to attempt to quit, if there's an agreement on a plan of approach, document all of these things. And then also the implementation date, note that as well. The method of follow-up with this patient, and then documentation of exact time spent in face-to-face counseling with the patient. So I think this is a wonderful approach from NGS, and I'm hoping to see this type of education released out by all of the MACs one by one. I think it's wonderful. All right, and finally, I focus Season 14 Spark on change. I want this 14th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their insights and their wisdom on change. So in this week's inspiring quote in Spark is from Paulo Coelho. When we least expect it, life sets a challenge to test our courage and willingness to change. At such a moment, there is no point in pretending that nothing has happened or in saying that we are not yet ready. Wow. So very true, right? This quote reminds us that we will be tested. There are times in all of our lives that we will encounter challenges. This quote encourages us to dig deep and recognize, what will we do? If we do nothing, we risk everything. I'm happy Paulo Coelho's spark still burns brightly and inspires so very many. All right, you guys, that wraps up today's episode. And as always, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.